Hi folks, so I wanted to briefly go through looking at CBD as a therapeutic. So in the last little video that I did, we talked more about some of its effects by looking at animal and cell models. Now we're going to talk about it in humans. So the background for this that they provide in the systematic review and kind of rationale as to why CBD might be a nice drug to look at is there's no evidence for dependency or abuse potential. So particularly when we're thinking about managing pain conditions, this is really important. As I'm sure many of you know, opioids can have highly addictive properties and they're kind of the gold standard still for managing chronic pain right now. CBD tends to have quite mild side effects in that those side effects might be sleepiness or diarrhea, and it tends to be fairly short term. It seems that there's a low risk of significant drug interactions. And as we talked about before, CBD mediates its effects through a number of different receptors. So CB1, CB2, a serotonin receptor, and a number of different GPCRs. And again, depending on the clinical condition that's being studied, one or more of these receptors might be important. The purpose of the systematic review by Millar et al., and you can see the reference there at the bottom from 2019, was to comprehensively collate all published data relating to CBD administration in clinical populations and really looking at the CBD doses. And if you think about this, this really makes really good sense. You want to know kind of what are the benchmarks for how much CBD is being administered for these different conditions. Is it different across different conditions? Is there a good window of therapeutic use, or does it seem like there are all sorts of different concentrations? So that's what they're looking at with this systematic review. Now, when you look at a systematic review, they should give you their methods. And basically with this, they're saying how they decided which articles to evaluate and not evaluate. So if you look at the identification at the top, what they did is they looked through a number of different types of databases. So Embase, PubMed, and clinicaltrials.gov. Then they did some screening, so they found some duplicates that way. And then they looked down for eligibility, okay? And with the eligibility, they were looking for full text articles, right? So not just abstracts or presentations at a conference, for example. And you can look at their exclusion criteria as well on in that box on the right. So not a full text article, if they weren't using CBD alone, if it was a review or letter. So based on that, they started with 204 full text articles. What ended up happening is that they ended up looking at 35 in total. Okay, so you can see they went from 1,038 all the way down to 35. Okay. So some of their brief results that they looked at, so they were looking at a couple of different disease states. Okay, so a systematic review, again, is taking a look at the evidence that's currently available across a number of different publications. So what they were looking at in terms of the different conditions, they found that epilepsy was the most studied medical condition. This makes sense if I think back to what you guys were talking about in the forums. A lot of you mentioned epilepsy when thinking about CBD treatments. All studies showed benefits of CBD in reducing the frequency or severity of the seizures, which is awesome. And you can see that the dosing ranged quite a bit from 15 megs per kilogram to 42 megs per kilogram, and then that last is per day. In the rest, though, of the conditions that they looked at, there's kind of a mixed sort of results. So they looked at bipolar disorder and schizophrenia. They put these two together, which one I think is interesting anyways. But they found some mixed results. Sometimes it seemed to be beneficial in decreasing psychotic symptoms. Sometimes it was good as an adjuvant. So in addition to the regular medication that this individual might be on, and sometimes there is no effect. And lastly, a number of you talked about different studies in the lay literature where they were talking about CBD for treating anxiety. So they used a double-blind randomized control trial at a dose of 6.7 megs per kilogram to look at social anxiety disorder, okay? And what they found was that, now if you look at the N value, this is pretty small, okay? In 10 adults with social anxiety disorder, they did have decreased social anxiety, okay? So what have we learned then from this systematic review? So these are the kind of takeaways that the authors have. Is essentially that because there's not too many side effects or toxicity. CBD is great to study. They also found that there's quite a wide acting dosage range. And overall, that studies with higher doses tended to have better therapeutic outcomes compared to lower doses overall, which probably makes some good sense, right? So essentially what they're saying is this is kind of a preliminary study. So they're saying that we need to do some more evidence and do more studies looking at plasma concentrations that are efficacious when using CBD. So what is your hot topic? Well, if you so choose to do it, and again, you don't have to, if you are happy with the 3 hot topics that you already did, with your mark on that, you do not have to do this hot topic. This hot topic is not meant to be painful, okay? So essentially, it's looking at the therapeutic efficacy of CBD. So as I say, there's a number of different clinical trials taking place. If you go to this website that I have listed at the top, clinicaltrials.gov, and look at current CBD clinical trials, you can see a whole bunch that are going on for a whole slew of different things. And really what I want is part 1 and part 2 completed, as I show you on here. And I'm going to give you an overview of that. So basically, I'm going to have a template that you can very simply fill in for this hot topic assignment. So part 1 is thinking about the experimental design and critically evaluating it, and looking at this on the clinicaltrials.gov website. So you're going to pick one clinical trial and then look through and really analyze what's going on. In part 2, what I want you to do is create a short lay summary of the clinical trial. So essentially, I want you to pretend that maybe one of your family members has one of these conditions that CBD is being evaluated to treat. So you want to write the summary as if you're describing the clinical trial and its purpose to a family member who might have the condition being investigated. So maybe they found this online or through their physician, and they said, hey, you know, you're smart, you're in MedSci. What do you think I should take a look and enroll in this clinical trial? Why or why not? So essentially, you have to explain it to them and then kind of give your 2 cents about whether or not it's a reasonable clinical trial for them to enroll in. All right. So that's kind of your last hot topic. Again, I will put up an outline of this very briefly. Thanks, folks.